Hi, my name is Kathy McAdory. I'm a registered nurse and a student at Auburn University School of Nursing. Today I would like to talk to you about a healthcare issue, health literacy in the end-stage renal disease patient. My audience that I would like to speak with would be our U.S. Representative for the state of Alabama, Mike Rogers, and my fellow healthcare professionals. A little information about this issue would be, did you know that 26 million Americans are affected with some sort of end-stage renal disease? Patients in this population often are labeled as non-compliant, with poor health literacy and poor disease management, when in fact, this disease process, these patients often are just undereducated. Did you also know that there is no standard education forum for these patients? We have education systems set up for congestive heart failure, for HIV patients, for diabetic patients, but there is no education system in place for these patients. To give you some idea of the money and the cost that is associated with these patients' care, in 2013 alone, Medicare expenditures were greater than $30.9 billion. In comparison, cancer research for the same year was 6 times less. 1% of our national budget is set aside for dialysis care. With that great number to give you an idea of how much money this is, 2% of our national budget is used for education. Ethically, it's our responsibility to ensure that the funds that our taxpayers entrust us with are used for the best good. It is also our responsibility to ensure that these end-stage renal disease patients receive education that will equip them to have a better quality of life and in part also cost less. Did you know also that the American Kidney Fund has recently started a program called First 30? During these first 30 days of hemodialysis initiation, these patients are provided individual sessions of education. In order for me to establish what needs to be done first, so our next steps would be we absolutely need to have more research into developing an education program. It's important that we lobby for funding, for program development and proper training for the educators providing this education. We would need to start education before dialysis started. And we also could track how our systems are working by tracking serum phosphorus levels and potassium levels, and also interdialytic weights. These have all shown to be very successful in providing and proving the success of First 30. Also, we need to ensure that all stakeholders understand and support the development of an education system for these patients. Because if we stop and look how we are going to impact the healthcare industry and improve the healthcare cost would be actually starting a process of educating these patients. With this in place, there could be greater resources for research to find more cost-effective solutions for hemodialysis, and in part, actually see a decrease in cost. Also currently, we have patients who are being transported to dialysis by private ambulance. This takes up about 60% of our budget that is set aside. With home dialysis initiation, this also could become a solution to this problem. So I ask you to carefully consider your support and to research yourself to find what an important role health literacy improvement could be for this population. Thank you.